Welcome to our soft tissue handling and dissection module. I'm Duretti Fufa from the Hand and Trauma Services. The first part of this module is just to review some basic instrumentation commonly used in orthopedic surgery. First, we'll start by reviewing scalpels. The first blade is a 10 blade. This blade is often used for skin incisions in larger parts of the body, the upper part of the arm, the legs, the spine. This blade has a wide belly, and it is the belly of the blade that is meant to do the work. Most commonly, people describe that in using this instrument, you should hold it as if you are holding a violin bow in this kind of a manner in order to utilize it. That's the 10 blade. The next type of scalpel is a 15 blade. This is more commonly used for smaller areas such as foot or hand surgery. You can see that the belly of the blade versus the 10 blade is much smaller, but we still also do use the belly of the blade for this work. This suture is most commonly used by holding it in a way as if you're holding a pencil to do the work. The final blade is an 11 blade. As you can see, this blade has a much sharper edge than the 15 or the 10 blade. It is commonly used for stab types of incisions, such as in arthroscopic surgery, or for cutting very sharp edges, such as freshening up tendon edges in hand surgery. Also typically used as if you're holding a pencil for doing either the stab or if you're cleaning up a tissue edge, either a tendon or a ligament used in a sawing fashion. Next, we're going to move on to types of scissors, rather. The first type of scissors we'll review is a Metzenbaum scissors. These scissors have fine edge with a rounded edges and are good for dissection in tissues that are more delicate. A Mayo scissors also has a curved edge similar to the Metzenbaum scissors. As you can tell, the caliber of this is a little bit bigger, so is used in larger surgical fields such as in hip surgery. Most commonly for holding scissors, the most common way that people hold them are to cradle it with their thumb and ring finger, and then your index and long fingers are also helping to support it, but there's many ways to utilize your scissors. Next, I have demonstrated a tenotomy type of a scissor, which is utilized for hand surgery most commonly, also in foot surgery. The ends of these sutures have a rounded edge to prevent traumatizing small structures that we might be operating around, like nerves and blood vessels, but the tips are much more fine than even in the Metzenbaum scissors, allowing for smaller dissection. And then finally, your standard suture scissors, and we'll talk a bit about how to use these appropriately for cutting sutures as well. Suture scissors can also come in smaller varieties when we use them in hand surgery. We'll move on to some types of forceps now. Here we have an Adson style forceps. This is an Adson forceps that has teeth on it. You may be able to see the fine edge here. We use this routinely in hand surgery, and you will also use this type of suture type of forceps as you are suturing more close to your skin edges. They are finer at the tip and so therefore have less trauma to the soft tissues. While the Adson forceps has teeth at the end, a DeBakey forceps, which is these, are completely rounded at the end, and these are typically used for dissecting around blood vessels and nerves. You can see that no part of this DeBakey forceps has a sharp edge, and that's why it's utilized around very delicate structures. Typically, forceps are used as if you're holding a pencil, but again, you may be using it in different ways depending on the demands of the certain surgical field in which you're working. The final forceps I'll demonstrate is called a Bonney forceps. This has tips at the end. These are utilized for larger surgical fields, commonly used in hip, knee, and spine surgery for the deeper layers of tissue. Again, you would not use this type of suture at this type of forceps rather at your skin edge, as it would be too traumatic to the tissues. But using it at the level of the fascia and the deep subcutaneous tissue is appropriate. Next, a variety of retractors, starting from small and moving to large. These are called skin hooks. These come in various varieties of smaller, bigger, wider, and these are often used in more delicate surgeries such as hand and foot surgeries, just to help as soon as you've made the skin incision. You can see with these small hooks, the level of trauma to the soft tissues is less. This is a Nail Retractor, also commonly used in foot and in hand surgery, and less so in surgery of the larger joints. It has two blunt right angle retractors, one smaller and one larger, and are commonly used to retract longitudinal structures such as blood vessels, neurovascular structures, tendons in an atraumatic fashion. A Sen rake is a similar retractor, but slightly larger to the Ragnell. The right angle is bigger than at the Ragnell, and on the other end, as opposed to having a right angle, it has what we call a rake. The rake on the edge of this particular Sen is blunt, but they also come in sharp varieties, and there will be circumstances in which the right angle doesn't allow you to get the appropriate tension on the tissues. It may slide off, and that's where using a rake for a little bit extra traction in your soft tissues is helpful. You will want to select a sharp versus a blunt rake depending on what the tissues that you're retracting are. Obviously not electing for a sharp retractor when you're working around delicate neurovascular structures. This next retractor is called an Army-Navy retractor. Again, has two right angle retractors on the edge, but of a larger caliber than what we saw. This is very commonly used in all upper extremity surgery and lower extremity and hip surgery. Again, for providing a right angle retraction that is distributed over a wide surface area as to avoid any specific tension on the soft tissue structures. Next, we have a Holman Retractor. This type of a retractor comes in many different sizes. This one is one that's used commonly in hand and foot surgery, but larger varieties of these are often used in hip and in knee surgery. The curved end of this Holman Retractor is meant to post on the edge of bone most commonly, whereas the belly of this instrument then is providing the retraction. So if, for example, this Army-Navy retractor is the bone, and there's some soft tissues blocking my ability to see the bone, I would put the toe of my Holman retractor on the edge of the bone, and then the belly of the instrument pushes those soft tissues out of the way. Again, doing it through this broad base makes it in an atraumatic fashion. Here we have a Langenbach type of retractor. These also come in varieties of sizes, but is a one-ended right angle type of a retracting device. The edges may be longer, shorter, broader, and all are Langenbach style of retractors. The last two retractors that I'll show here are self-retaining retractors. What these mean are that they are going to hold two edges of the tissue apart, and they have a mechanism by which it locks in position to self-retract, as opposed to having to have two people holding the edges apart. These retractors also come in sharp or in blunt varieties, and in various sizes. And again, election of whether it's sharp or blunt will depend very much on what how delicate you need to be with the tissues that you're retracting. This next self-retaining retractor is called a Lp Retractor. As you can see, it has very sharp ends on it versus this blunt wheat laner style of retractor. It therefore cannot be used when you're retracting delicate longitudinal structures, but is commonly used in shoulder surgery for retracting the muscles overlying the shoulder capsule to keep those out of the way.